Good morning, everyone. It's 10 o'clock, so we'll go ahead and get started. Welcome. My name is Danny Dunstan, and I'm the Chief of Staff in the President's Office. I really appreciate you all joining today to learn more about the COVID-19 screening program. So we have Ginny Larimore on the line. She's our Director of Brand Management and Trademark Licensing, and she will be serving as our moderator today. So she's going to put some instructions in the chat now about how to go about submitting questions anonymously, and feel free to go ahead and submit questions as we go. So this town hall is to provide guidance to ISU students, faculty, and staff to ensure everyone has the same information about our new COVID-19 screening program, as well as our university safety procedures for the spring 21 semester, and details about what you should do if you receive a positive screening result for COVID-19. So before we get started, I'd like to turn it over to President Satterlee for a few words.
Thanks, Danny, and welcome everybody. Appreciate everybody on our team showing up for this. It's important. Thank you all for being here today. So our COVID-19 screening program is specifically designed to provide an additional tool to identify asymptomatic individuals in our population so that we can further mitigate the spread. This program was created based on some carefully reviewed scientific, medical, evidence-based strategies to mitigate the spread of COVID-19 in a university environment. The screening program can't fully eliminate risk of COVID-19 on our campus, but it should be noted that this program doesn't replace, it doesn't supplant any of our other measures we've been taking regarding masks, distancing, increased sanitization, limiting gathering sizes. All of those items are still important and they remain in place, and screening is going to be an additional tool that we're going to implement to help. So why are we doing this? It's simply because we've all witnessed the surge in COVID-19 as we moved into the fall and winter, much worse than it was in the summer or the beginning of the fall semester. Public health experts expected this to happen, and it did. And nationally, the advice on college and university campuses is a screening program like this now. So for us to continue to offer our in-person instruction to the level we're doing it, for us to continue working in our working environments on campuses, we've added this screening program to help our campuses be as safe as possible and continue in our current mode of instruction and operation. Now, this is mandatory. It's mandatory for all students, faculty, staff, and affiliates who are having an on-campus presence. So except those who have a valid medical or religious exemption, this is mandatory. Individuals working entirely remotely, or students who take all of their coursework through distance delivery methods and are not going to be on campus. Other than that, everyone is required to participate. It is mandatory for those who are on campus because we all have a duty to keep each other safe, and this simple screen will help us do that. This screening, combined with face coverings, combined with social distancing rules, our hand washing protocols, our telework guidelines that we have in place, the crowd size limits, these are all designed to work together for the health of everyone involved. So I appreciate everyone's participation in this, and we all come together to work on this as a team. It's going to help. And so with details on the reasoning, the scientific why behind this, and what we're doing now, I'm going to turn this over to Dr. Rex Force. So thank you, and Rex, go ahead.
Thanks, Kevin. Hi, everybody. Welcome back. Happy New Year. Kevin has already outlined much of the rationale for why we're standing up this screening program, but you may be wondering why now. And there are really several reasons why this makes sense now. First and foremost, we're committed to doing everything we can to make campus as safe as possible, particularly after the holidays. We expect that there will be an increase in cases at this time or in the following weeks after holiday gatherings and after people have spent time observing the holidays in groups, even if it was limited in group size amongst your families. We have seen what has happened after Thanksgiving as well. We're doing this now rather than in the fall because the COVID health team has determined that the circumstances today are different than they were in the fall. Disease activity is much greater than it was in August. Test availability is much better, including accurate, simple PCR tests with quick turnaround times. And that's the kind of testing we'll be talking about today. Contact tracing is also much more robust today and on campus. And there's also much more evidence to support the utility of asymptomatic screening on university campuses today than there was back in August. All of these factors make a screening program much more useful today than it was in the fall, and one that the health committee and the university leadership has determined is appropriate for our campus community. I'm happy to answer any questions as we move through the town hall today, and I'll be standing by Danny and Kevin to help answer any health questions as they come up.
Yeah, I do.
Thanks, Rex and Kevin. All right, so I'd like to introduce our panelists today. So we have the chairs of the various Roaring Back committees. So we have Dr. Rex Force, chair of the Health Committee, Dr. Craig Chatrand, chair of the Student Campus Services Committee, Dr. Joanne Tokel, chair of the Instruction Committee, and Katie Thomas, chair of the Employee Committee. We also have a number of other experts on the screening program on the line to help assist in answering any questions that come up that they might have more specific information on. All right, so to kick off the town hall, before we get to the live Q&A portion, we want to start with providing some basic information to ensure we're all on the same page. This information has been sent out via email and is available on the screening program website. So Ginny, if you wouldn't mind sharing the link to the screening program website, that would be great. So the spring 21 semester, ISU is launching a mandatory COVID-19 screening program for all students, faculty, staff, as well as affiliates who have a regular physical presence on campus. So the program really has two parts. We're going to focus primarily on the first part today, but we have the Return to Campus screening program, which requires all students, faculty, and staff, as well as affiliates with a physical presence on campus to be screened twice within a 5 to 7 day period during the month of January. We also will have an ongoing COVID-19 screening program for select populations with a physical presence on campus. So the Return to Work program will require any member of ISU's committee who spends time on campus, including the outreach centers, to undergo 2 non-invasive saliva-based screenings within a 5 to 7 day period. These 2 tests during the month of January are intended to identify anyone that is positive for COVID-19, but is either asymptomatic or not showing COVID-19 symptoms, potentially pre-symptomatic. So the launch of this program does not mean that all employees are required to physically return to campus. We anticipate having a continued blend of skeleton crews, remote work, as well as on-campus work throughout much of the spring semester. And this will all be in accordance with the university's operational levels. Further, it's important to note that you do not have to receive a negative result of the screening to return to work or class. The difference between our asymptomatic screening program that we're talking about today and COVID-19 testing is that our screening program is for people who have no symptoms and no known COVID-19 exposure. It is done to identify those who are asymptomatic or pre-symptomatic, so we can take the precautions to limit the spread to others. So folks going through the screening program can get screened, but then they can continue to be on campus before and after their screening appointments, so long as they do not develop symptoms or receive a positive screening result. COVID-19 testing, on the other hand, through our community testing sites at Holt and University Health, are designed for those who are symptomatic or have a known COVID exposure. So if you fall into this category where you either have symptoms or known COVID exposure, call the University Health Center at 282-2330 for testing information, as well as fill out the self-report form. And Ginny will put that self-report form in the chat window now. So that's really the difference between the screening program and the testing that we have in our community. So moving on to the next slide, this slide shows the dates, times, and locations of our testing or our screening operation. The site hours are generally 8 a.m. to noon, as well as 4 p.m. to 8 p.m. Monday through Saturday. However, the hours may differ slightly based on campus location. So you can review the screening program website for more information specific to your campus location. When you go to schedule your appointment through the Health Center portal, only those appointments that are available to be scheduled will be options for you in the Health Center portal. So you don't have to worry too much about knowing the hours of operations, because only those that are available will show up to you. Students and employees will schedule their first appointment during the first testing window listed there, January 6th through the 13th. And then they'll schedule their second appointment during the second testing window. The scheduling portal only allows you to schedule an appointment 7 days out. So the university will send out an additional reminder for you to schedule your second appointment when we get a little closer to that second testing window. Ideally, you should aim to schedule your 2 screenings 5 to 7 days apart. So when you schedule your first one, be keeping in mind when you're going to be scheduling the second one, it should be within that time frame. There will be 2 options for each campus location that include either a walk-in option or a drive-through option. Please note that the drive-through option does have less scheduling availability due to limited capacity. So if you're interested in that, appointments will be on a first come, first serve basis. So now I just want to spend a couple moments talking through the screening process. Yesterday, you should have seen an email to schedule your first screening appointment. The process is fairly simple. You just click on that link in the email, which is also on the screening program website, and you log into the University Health Center portal using your Bengal Web ID and password. You will need to verify your date of birth to access the site. If you have any trouble logging in, you can reach out to the IT help desk. From there, you will enter the Health Center portal, and there's a large button at the top of the screen that says Schedule a Mandatory COVID-19 Screening. You will confirm that you're scheduling a screening appointment for COVID-19. You'll be asked to verify your home address. You'll be asked to sign a consent form, and then you'll be brought to a page where you select your campus location and then the date and time of your preferred screening appointment. As I said, only appointments displayed are those that are available. You will then, once you click through that, you'll come to a confirmation page. And that confirmation page will also be emailed to you. It has a QR code. That QR code you'll need to bring with you to your appointment. You can bring that with you either on your phone and just have that email up on your phone, or you can print it off and bring it a physical hard copy with you. When you arrive at the screening location, there'll be instructions on how to provide the saliva sample. There's also a video on the website that details that process. It's important to note that regardless of a walk-in or a drive-through appointment, you should be wearing a cloth face covering at all times, except for when you're providing the saliva sample. It's also really important to note that you should not eat, drink, chew gum, smoke, or brush your teeth for 1 hour prior to your screening appointment. You'll receive a reminder of your appointment, which will remind you not to do any of those things 1 hour prior to your appointment. But if you can make note of that, that will be important. The reason that's important because those things could invalidate your results and require a rescreening. So the entire process, once you show up at the screening site, should take between 5 and 10 minutes. The results should come back to you between 24 and 72 hours. After your screening appointment, you are welcome to return to work, to class, but remember that everyone is still expected to follow the existing COVID-19 protocols. So for those folks in Twin Falls or Anchorage, you will receive email instructions specific to your campus location, which is a little different than the Meridian, Idaho Falls, and Pocatello campuses. Now, as far as test results, you will receive results of your screening within 24 to 72 hours. Once your results are ready, you'll receive an email and a text saying that your lab results are available on the University Health Center portal. Once you log into that portal, on the left-hand side of the screen, there is a link to the lab results, and that's where you can view the results. In addition to the University Health Center having access to the results, the state of Idaho requires aggregate screening data to be submitted to the Department of Health and Welfare. ISU is using a PCR test for these screenings. This is the most accurate test available. False positive results are very uncommon. Any positive result is considered evidence of the presence of COVID-19. If your results are positive, please begin isolating immediately. The university COVID-19 health team will reach out to you directly to provide further instructions for self-isolation, contact tracing, and follow-up medical care. While you await this contact, please do not come to campus or have close contact with others. Negative results are just a snapshot in time. They do not provide an exemption from following the university's health guidelines. Furthermore, if your results are negative after your first screening, you will still be required to take the second screening 5 to 7 days later at the same screening site. So just a couple of words on exemptions and deferrals. Some faculty, staff, and students may be exempt or have an alternative path to be compliant with the screening program. First, you may be exempt from participating in the program if you meet any of the following criteria. If you're a student taking only distance-based classes and do not have a physical presence on campus, you can be exempt. If you're an employee who works entirely remote and does not have a physical presence on campus, or if you have a sincerely held religious belief that prevents your participation in the screening program. In addition, there's certain scenarios where you may defer your screening for up to 2 weeks. If you're not feeling well for a reason other than COVID-19, if you're on vacation or traveling, or if you're currently in quarantine as a result of close contact with someone with COVID-19. So you may request an exemption or deferral by filling out the appropriate form, and all of those forms are located on the screening program website. So you just find the right form that applies to your circumstance and you fill that out and go from there. So there's also a few ways that you can be deemed compliant with the screening program and not have to participate for a number of circumstances. So I'll run through these quickly. If you have received a full course of one of the FDA authorized COVID-19 vaccinations, and you submit documentation that you've had both of the doses, the university health team will review that and deem you compliant. You do have to have both doses of the vaccine. If you have already had COVID-19 in the last 180 days, if this is the case, you would either submit documentation of either a rapid antigen or PCR test performed on or after July 6th, showing that you've had COVID in the last 180 days. If the University Health Center has record of you having COVID-19 in the last 180 days, including those who participated in on-campus contact tracing, you should, in the next day or so, receive an email directing you to check the Health Center portal, and then you will be deemed compliant and will not need to participate in the program. You can also submit documentation if you're regularly screened for COVID-19 for outside employment or outside student activities. You would just need to submit negative test results for both of those testing windows. And then if you prefer to get the screening done by another provider, you can also submit documentations of those negative test results for the 2 testing windows. So for most of these scenarios, you'll need to submit documentation of either your vaccination or your test results within the ISU Health Center portal, unless the health center already has record of you having COVID in the last 180 days. So the health committee will review your submitted documentation and mark you as compliant with the screening program in the system, or they'll reach out to you with more information. So Ginny's going to paste a link to the step-by-step instructions for submitting this documentation in the chat window now. And if you have any questions about that process, you can reach out to the COVID hotline. We also want to ensure that we have an accessible environment for students, faculty, staff, and other screening participants with disabilities, and will make every effort to provide reasonable accommodations in accordance with applicable laws. If you need accessibility accommodations in order to participate in ISU's COVID-19 screening program, you can make a request by filling out an accommodation request form, which is located on the screening program website. It was also emailed to you yesterday. So on the screening program website, there's also a list of FAQs, which have been compiled to educate the campus about ISU's screening program. And then if you have additional questions that are not covered today and you can't find them on the website, you're welcome to email covid@health.isu.edu or call 282-2705, and that will get you to the COVID hotline and someone will respond to your specific question as soon as possible. So that goes through kind of the preliminary basics of how the program's going to work. I'm going to turn it over to Ginny, and we have our panelists on the line. And we'll go through the live Q&A portion of today's town hall.
Okay, thanks, Danny. We are ready for some questions. Okay, we have quite a few questions. The first one, let's see, I've scheduled my first appointment for January 6th. Following the directions for the second test to be 5 to 7 days apart, I scheduled my second test on January 13th. However, that is not within the second test range of January 15th through the 22nd. Please advise. And Danny, I'm going to turn that back to you.
That's a great question. So your 2 tests do need to be within the 2 different testing windows. Your first test between, and we'll send out those that PowerPoint with the testing windows within that first testing window, and the second appointment within the second testing window. So if you've gone ahead and you've scheduled them both within the first testing window, you should go in and cancel one of those appointments and reschedule in the second testing window. But as I mentioned, the portal only allows you to schedule appointments 7 days out. So you can go ahead and schedule your first appointment now, and the university will send another email reminding you to schedule your second screening appointment prior to that second screening window. So Rex, anything to add there?
No, I think you covered it. We want people to be in the 2 testing windows, and we realize if you get tested early, 5 days is still within the first window. We just need you to schedule in the second window. I did see, Danny, on the slide, the first testing window does go to the 14th, as noted in the email that went out yesterday, and the second testing window starts on the 15th. So there is an error in one of the slides we showed today.
Okay, thanks, Danny and Rex. Next question. Even with 95% compliance, that will be 400 plus students we need to put through the discipline process. How do we have the resources for this, and how will compliance work? And for this answer, I'm going to turn it over to Craig Chatrian.
Morning, everyone. Thank you so much for that question, Jenny. We do have the resources to make sure students are complying with this program. It will, like so many things that we've done over the last year, we'll ask staff across the Division of Student Affairs to develop some new skills and maybe help with some areas that they haven't spent quite as much time on. But for compliance, what we're really, what our aim is to provide the best environment for our faculty, staff, and students. And so the first step of compliance is going to be explaining to students who are hesitant about participating in this program why it's important, what we're trying to accomplish with it, and why it's helping keep in-person classes active throughout the semester. If students are still hesitant about being compliant, then we can help them find online classes. We can help them try to take their classes in an environment where they don't have to be physically on campus. But ultimately, if students do have to be on campus for classes or for other commitments, other meetings, but have a regular presence on campus, they will be required to go through the screening process.
Thanks, Craig. Next question, is ISU considering or planning to have a vaccination option for students in clinical and community practicum settings? And for this answer, I'm going to turn to Rex.
So that's a great question. Obviously, we've been spending a lot of time on standing up the screening program. But with the availability of the vaccination, we're paying very close attention to being able to distribute that to the appropriate groups at the appropriate time. And as you know, the state of Idaho has set out guidelines for who should be vaccinated at what time. We're in discussions right now with the health department, in particular related to students and faculty that are in patient care areas regularly, to prioritize them. And so we'll have information forthcoming in the next little bit about how we can get those folks vaccinated. The university is making an application at the present time to become a COVID vaccine provider. That takes a few days for that to be implemented. And we'll be keeping the campus community informed on availability of vaccine and how we're going to roll out those programs as the semester moves forward.
Great, thanks, Rex. And hang with me, this next question is for you as well. I have clinical faculty that are here only once a month, and they are scheduled for the end of this month. How do I proceed with them? Second part, I also have residents who are mid-vaccination cycle. Are they obligated to be screened?
So I'll take the second bit of that first, because it's really straightforward. And that is, if people have not completed the vaccine cycle, then they need to go through the screening process. If they are to complete it, for example, during the first window, which goes until the 14th of January, then they could be exempt from that process because they would document both vaccinations prior to the end of the first window. Otherwise, they need to be participating in the screening process if they're mid-cycle. Regarding the first question, with folks that are here later in the semester, those individuals can defer, and those individual cases should be referred through the COVID hotline for guidance so that we can then provide you with the right kind of instructions for those individuals who will be on campus later in the semester. We have had this question many times related to either students or faculty that will be on campus later. We would prefer to do any screening closer to the time that they're going to be on campus, and we can provide you with guidance on how to have that be done. The testing that we've been talking about, the screening program that we've been talking about today, is really for the first 3 weeks. We will have ongoing screening programs available for campus, not at Reed Gym, but at another location that we will be talking about and making available to the campus community. So there will be ongoing screening for asymptomatic individuals throughout the rest of the semester, just not at this mass testing site.
Thanks, Rex. And hang with me one more time here. I just finished my quarantine and recovery from COVID over the holiday break. Do I need to complete the screening program before returning to campus?
So if you finished quarantine, then you would, and never tested positive, I'm presuming, because it was a quarantine, not isolation with a positive test, then yes, you would have to go through the screening process again. We're treating folks that don't have confirmed positive COVID as it being necessary for them to go through the screening process. So if you don't have a positive COVID in the last 180 days, then you do need to go through the screening process.
Okay, thank you, Rex. This next question is for you as well. Question from a student. If the first time a student needs to come to campus is in February, should they wait until closer to then to get screened? And the second part is, will ISU continue testing throughout the semester?
Yes, and I think I sort of addressed that one earlier, Jenny. We're going to have ongoing screening opportunities. And so if someone is coming to campus later in the semester, we'd like them to participate closer to the time that they're going to be on campus. And we'll be sending out information over the next week or two as to how to access that ongoing screening opportunity.
Okay. Next question. If I did not receive an email yesterday, and when I checked my health portal, my email was incorrect, if employees don't receive an email, what should they do? And I'm going to turn this over to Renee Scott for this answer.
Hi, yes, if you feel like you should have been in the system and didn't get an email, please reach out to our help desk. That's 208-282-HELP, and they can get your ID set up for you if that's the issue.
Great, thank you, Renee. Next question. The dates provided have confused many of my students because the 2-week set of dates are farther than 7 days apart. If the minimum is 5 to 7 days between screenings, then what is the maximum? For example, I scheduled my first screening on January 6th, therefore 5 to 7 days is the 11th to the 13th, which is not during the second screening set of dates. This is confusing my students. I'm going to turn this to Danny to direct it accordingly.
Okay.
Thanks, Jenny. And I'll let Rex weigh in. Our goal is that we should strive to have them 5 to 7 days apart, but because of the way that our system is set up, we did have to stretch out those testing windows a little longer. So Rex, anything to add there?
No, we want one test in the first window, one test in the second window. That's really the most simple answer to give to your students. And because we wanted to be able to test employees as they were coming back to campus this week, and the majority of students coming back late this week over the weekend, we needed to make that first window a little bit longer to capture everybody. But the simple answer is a test in each window.
Okay, thanks, Rex. Next question, can we please clarify the best way to make sure affiliates are on the email list for future testing efforts, such as volunteers or contractors that departments regularly work with who are regularly on campus? And then Danny, I'm going to give that one to you as well, please.
So we have in Rex's office, Connie Tillotson, who is helping us manage our affiliate list. So we'll provide her contact information in the chat window. And if you're unsure if some of the affiliates that you work with are on that list, you can reach out to her directly by email, and she can reference our current affiliate list.
Okay, thanks, Danny. Related question, what is the process for contractors working on campus as subcontractors?
So we have worked with the Division of Finance and Business Affairs to try to identify all the contractors on campus, including subcontractors, that meet our definition of regular on-campus presence. So we believe we have captured all of those individuals. But if you are aware of folks that might not be on that list that we might have missed, go ahead and reach out to Connie, and Connie can cross-reference that and gather any additional information about contractors you're aware of to make sure that we get everyone participating in the screening program.
Okay, thanks, Danny. So this next question is about screening, but it's stated as testing. So I just want to clarify that. So my question is about employees who refuse to be tested because they think the COVID-19 pandemic is a joke. I have no problem with being tested, and I am taking the pandemic seriously. However, I have coworkers who think it's a joke, do not wear masks at work, and refuse to be tested. What happens to the employees that refuse to be tested? And for this answer, I'm going to turn it to Brian Seidendorf, please.
Thanks, Jeannie. Thank you for the question. Thank you, everyone, for joining in today. Employees who refuse to participate in the screening program will not be permitted to perform their work on campus. The HR office will work with departmental leadership to consider if 100% telework is a viable option for positions where that's feasible. Where telework is not an option for positions, the HR office, in coordination with the respective management teams, will consider the appropriate action on a case-by-case basis, which could include the use of accrued leave by the employee or considering whether an unpaid leave of absence is the appropriate step.
Okay, thanks, Brian. Next question, do students and faculty have to test in Pocatello or just through these locations? And I'm going to turn that one to Danny.
I'm sorry, Jenny, can you repeat the question?
Absolutely. Do students and faculty have to test in Pocatello or just through these locations?
So we have the screening programs set up at each of our outreach campuses as well as on main campus. So you can, if you're in Pocatello, you can schedule at the Pocatello campus. If you're in Idaho Falls, you can schedule at the Idaho Falls campus. If you're in Meridian, you can schedule at the Meridian campus. The only differences are with Twin Falls and Anchorage, and they are receiving direct communication from the administrators at their campus locations, providing specific instructions for those campuses. But we have the same testing windows and dates set up at Idaho Falls, Meridian, and Pocatello.
Great, thanks, Danny. I'm going to keep you for this next one as well. Can both of your screens occur in the first set of dates as long as they are 5 to 7 days apart?
Nope, unfortunately not. We had hoped to have that set up in the system, but the system functionality did not let us do that. So if you end up scheduling both of your screening programs in the first testing window, you will not be compliant with the second part of the screening program, and you'll get reminder emails to schedule that other screening appointment. So you need to make sure they're with they're in the 2 separate testing windows as posted. And then, yeah, and Rex, anything else to add with that? Okay.
Nope.
Okay, Danny, also there's some confusion about availability of times. So this person, when they were scheduling it, kept saying that the times were not available. Will the program be updated to show only the appointment times not already scheduled?
So we had, when we sent out the email yesterday, we had really timely participation in folks scheduling their screening appointments. So as soon as one of the available appointments was scheduled, it removes it automatically from the website. So what you need to do is you need to log into the health portal and choose around a date range that works for you, and then search for available appointments. So the appointments are available on a first come, first served basis, and we'll be continually monitoring the appointments to make sure we have adequate number posted. But if you say you chose the 6th for the screening and there's none that pop up, move it out a few days and see what pops up. And then if you have trouble, you can reach out to the COVID hotline and they can help assist if necessary.
Related question, Danny. What if you are an affiliate and you don't have a Bengal ID to log into the portal with? How do you schedule an appointment?
Yeah, so the affiliate process is a little different, and all the affiliates that we have on our affiliate list, they received a slightly different email than students and employees did yesterday. So what those individuals will do, they will go in and they'll click on the screening program website. There's a button that says schedule your appointment. And when you go to that site, it allows you to log in as either a student, faculty, or staff, or an affiliated student or contractor. So what you're going to do is you're going to click on that affiliate, contractor, affiliated student button, and you're going to sign up for an account. That's the key difference with affiliates. You sign up for an account and you'll set your own password, and your username will be your email address that you sign up with. And you'll have to verify that account with a cell phone number and a text message, that two-step authentication. And then you'll be able to access the Health Center portal once you sign up for that account as an affiliate and schedule your screening appointment.
Great, thanks, Danny. Next question. If I am working fully remote, but may have to come to my office once a month or less, do I still need to be screened? And for this answer, I'm going to turn it over to Katie Thomas.
I can answer that. So this is intended for employees who are working regularly on campus. So if you are working fully remotely and may occasionally come in, very rarely, provided that you're following all of the other procedures, not interacting with the rest of your team, like coming in for meetings and things like that, then what we'll ask you to do is to fill out the employee remote work exemption. And so you can request an exemption from the program and not necessarily have to be screened as long as you have an approved telework agreement on file. So that process will walk you through the steps to request that exemption and work with HR to get that telework agreement completed if you don't already have one in place. And I can put the link to that exemption process in the chat.
Great, thanks, Katie. This next question is about the consent form, and I'll be asking Blake Christensen. So the question is, what does the consent form say we are consenting to?
Yeah, great. Thanks, Jenny. Happy to pop on here and answer questions along the legal lines. The consent form has two main parts. One is a consent to participate in the screening program itself, consenting to giving that saliva sample. The other piece of the consent form is authorization for the exchange of information. We have our screening partner, T3. We need to give them the information as part of that sample set, and then they would take that sample result and send it back to us. And so it's authorizing that exchange of information. So, excuse me, there are a few other lines there. You'll see there's some information about electronic communications. There's information about some of the things we've talked about today, the consequences of not participating in the program, et cetera. So it's worth a read. It's not too long. It does have some good information there. I'd suggest that you take a look at it as you consent.
Great, thanks, Blake. Next question. Will the screening identify if we have had COVID-19? Individuals have claimed they have had no symptoms with COVID-19. And for this answer, I'm going to turn it to Rex, please.
Ginny, you were breaking up a little bit there. Can you repeat that? Sorry, I'm having
Absolutely.
stability issues with my internet.
You bet. So the question is, will the screening identify if we have had COVID-19? Individuals have claimed they have had no symptoms with COVID-19.
Right. So there have been asymptomatic individuals who have ended up having COVID. And in fact, that's partly what we're looking for here with this asymptomatic screening program. We want to identify people that are either pre-symptomatic, meaning they may go on and develop symptoms, or those individuals who are carrying the virus and not showing symptoms or very, very minimal symptoms. It will not identify, this test will not identify people that have previously had COVID, true COVID, and not demonstrated symptoms. That's called an antibody test, and they're still working out the effectiveness of that test and how we might use that for screening purposes and clearance for work and that sort of thing. This is detecting the actual virus in your saliva. That's what the test is doing. And again, as Danny mentioned, This testing center is for those individuals who do not have symptoms and who have not been exposed recently to anyone with COVID. Those individuals should be quarantining, and anybody with symptoms should be isolating and not coming to campus and communicating that exposure or illness through the self-report form to the COVID tracing team. So this is for individuals without any symptoms who are returning to the campus community, but it will not pick up those individuals who've had COVID in the past. If you have had COVID in the past and claim that, we do have systems in place for you to upload your laboratory information so that you can go on the exemption list, as Danny outlined.
Great, thanks, Rex. I'm going to hang with you for this next question. There are a few questions about the drive-through process. So people really appreciated the video for the walk-in testing, but they're wondering about the method for drive-through. How will that work? Can you walk us through the drive-through process, and how can people identify where to go and how to stay in line?
Yeah, so the drive-through process is on the back side of Reed Gym. And by backside, I mean between the South Complex and Reed Gym, that student housing complex there. You enter as if you are entering, going up to the Performing Arts Center. And so you will come in that entrance, and there will be signs out on the main road there, as well as directing traffic sort of through the parking lot to the backside of Reed Gym. The way our workflow is currently set up is we'll be able to distribute the testing kits to about 5 to 10 cars fairly rapidly. Those individuals will begin collecting their sample, much like you see in the video. Much of that process is similar. And then as they finish collecting, other workers will come through, other volunteers, and we appreciate everybody volunteering to help. They will come through, pick up those samples and dispose of the waste that's present, scan those samples with our barcoder, and then we will ship those samples off. Somebody did ask in the chat what happens to the samples. The samples are destroyed by our laboratory facility once the tests are run.
And I would just add on to that, that there are drive-up options in Meridian and Idaho Falls as well. We have Gabe on the line who can provide information on where the Idaho Falls drive-up is. Gabe, if you want to chime in.
I'm actually Meridian campus.
Sorry about that.
That's all right. Thanks for including me. So our drive-through is more of a park and screen. It's going to be right outside the clinic entrance. There will be signs and volunteers. So just follow the signs and volunteers. Our walkthrough is right inside the clinic entrance. You'll again see signs. There'll be volunteers to let you know where to go.
And then Lyle.
Yeah, for Idaho Falls, the north side of the Benyon Student Union building is where the drive-up is located. And you'll see signs right as you pull into campus, which directs folks both to the drive-up location and to the walk-up location, both of which are centered around the Benyon Student Union building.
And when you're signing up for your appointment, you can choose those locations through a drop-down menu and get the specific schedule for making an appointment with those locations.
Great. Thanks everybody for those answers. Next question, I'm going to do two-part and give it to Danny. What if the times left that are available do not work with my schedule? And did non-credit students receive the same email?
I'll answer the second one first. So we should have in our student email list, any student who has classes that have an in-person component. There were some students that were signed up for entirely remote classes who may not have received an email. But if you have a student with on-campus in-person classes, they should have received this email. And if they didn't, you can reach out to the help desk, the IT help desk, and make sure that they are in the right feed. And can you repeat the first part of the question, Ginny?
You bet. The first part was, excuse me, I lost my place. What if the times left that are available do not work with my schedule?
Rex, any thoughts on that one?
Well, we have tried to make it as flexible as possible, including some Saturday time on this coming Saturday. We're available in the morning and the afternoon. We really have tried to be as flexible as possible. If that doesn't work with your time, we'll have to come up with an alternative testing, testing strategy. But we have evening times, we have Saturday times in the first window. We have early morning times starting as early as 8 a.m. We hope that people can be, can get in during one of those time slots.
Yeah. So if I would just make sure that you're looking at each day in the first testing window to see if you can, slide in 5 or 10 minutes here or there within your schedule. And if it's really not possible for you, I think just reach out to the COVID hotline and we'll do our best to work with you.
Okay, we have a lot of questions, Danny, about rescheduling or mistakes on the windows. Can you reiterate for us, what do you do if you need to change your time, or if you have questions about that?
Yeah, it's actually really easy to go in and reschedule your appointment. What you're going to do is you're just going to log in to the same health center portal. And to do that, you can click on the email link that you received yesterday, or it's on the screening program website. And you'll go into your account. On the left-hand side of the screen, there's a number of links, and you just click on the one that says appointments. It'll bring up all of your scheduled appointments. If you've scheduled more than one screening appointment within the first testing window, you'll just go in and hit cancel one of those appointments. And it's a real simple process to just go through and cancel one of those appointments. And then once you get another email reminder from the university to schedule your second screening appointment within the second testing window, you can go ahead and do that at your time. But at any point, you can log in to the health center portal and you can review your scheduled appointments and cancel them and reschedule them as necessary. So pretty simple. And if you have questions or are struggling to go through that process, we're happy to help. Either the COVID hotline can help, or the IT help desk can help as well.
Danny, I would just add that we're getting a lot of comments. I'm trying to follow the chat as we're going along here. A lot of comments about people having difficulty scheduling. You can change your search window by changing the date range that you're looking at. And we're going to look into all these questions just to see if there are actually glitches in the system. And figure out just exactly where, where we have availability. I will say that we've gotten close to 3,000 appointments already scheduled. So it's very possible that some of the time slots have filled up, especially early on in testing window number 1.
Okay, thank you, Rex and Danny. Next question is about the technicality of presence on campus. Can we clarify what is considered regular presence on campus? And also a specific question, I'm working from home and rarely go to campus. If I do it as after hours, should I do the screening? And I'll send that to Katie, and then maybe Danny or Rex as needed.
Yeah, sure, I can help address that a little bit. So being regularly on campus is a little bit confusing. So let me try to give us some examples to clarify. So we have some employees who work on a rotating shift. So they may be in Monday, Wednesday, Friday kind of thing. We would consider that a regular occurrence, regular work schedule. And so they should be included in the screening program, even if they are, for example, working remotely Tuesday and Thursday. However, we have other employees, like the situation that you mentioned, where you work entirely remotely, but you may run in once a month to grab something off of your desk, or check your mailbox or something like that, but you're not engaging with your coworkers. You're not going in to work a full shift in the office or on campus. So in that case, I would say that's not really regularly working on campus. And so you could request the exemption from the program and then work with your supervisor to make sure we have a current telework application on file that really, the telework application really just helps capture what your work schedule is and clarifies that everybody's on the same page, that you're mostly working remotely. Did that answer the question?
I think it did. Thank you. Okay, Danny, how soon should we expect to see the email confirming the appointment once an appointment is made?
It should be fairly soon, within a minute or two. So if you did not receive that email, log into the Health Center portal again and click on the Appointments tab just to make sure it's scheduled. If it's listed in the Health Center portal, then you should be good to go. I'm not quite sure why you wouldn't receive an email, but there's a chance that maybe the appointment didn't go through. So you'll want to make sure and verify that it's on the books if you didn't receive an email.
And you may want to check your spam folder and that kind of thing as well.
And we've had a number of individuals go through and test this, kind of a broad array of faculty and staff. And for the most, all reports we have so far is everyone received an email and it didn't go to their junk folder.
Okay, thank you, Danny. I wanted to share some feedback that someone has posted for us. I want to say that universities everywhere have been struggling with COVID. I appreciate the work you all are doing and your efforts to communicate clearly while implementing enormously ambitious and right efforts to keep everyone working and learning safely in a variety of ways last semester and this. We have quite a few questions that have not been addressed. I will post right now, if you have additional questions that were not addressed today, and after you've looked online, then at our screening page, you can send an email to covid@health.isu.edu, or you can call the COVID helpline. And please continue to ask questions there. I would like to turn it over to Danny now for any follow-up comments that she would like to make. Thank you.
Yeah, I just want to thank everyone for participating. I know there's still a lot of pending questions out there, and as Jenny said, we'll absolutely get on trying to answer those as soon as possible and get our FAQs website updated to ensure that all those questions that come up pretty regularly are addressed. And I'd like to thank the team of individuals who have worked very hard over the last many months to have the screening program available to keep our campus as safe as possible. And I know President Satterley has a few words that he'd like to end with.
Thanks, Danny, and thanks everybody. First of all, everybody that's watching this right now or when they watch it later, thank you for participating in this. I am getting my first screening tomorrow morning. I will be there and I will be participating. This program is a result of a monumental lift by a whole lot of your colleagues who spent a lot of time making sure this would work, and a lot of time over the holidays. And they worked tirelessly over the holidays to make sure this will happen. So we all owe them our thanks. This program is medically appropriate. It's scientifically accurate. It's HIPAA compliant. It's the right program and it's going to work. And I am also 100% sure that some of you will experience a logistical glitch, or it won't be absolutely perfect. The perfect won't be the enemy of the good, and it won't be the enemy of the right program. We are going to do this for the safety of our community. This is a real pandemic. People in our community have died from it and are still dying from it. And this is one more thing that can help us be safe along with our other guidelines. That's why we're doing it. Please know that I understand that every decision like this that we make impacts all of us. Everyone is impacted by what we are doing. And I appreciate that. And that's not lost on me. So we're doing this for the right reasons to get there for our community. And I appreciate everyone's attention and thank you for being part of this.